Ever felt that sinking feeling when you get to the checkout and suddenly the price jumps? Like, where did all those extra...
Well, absolutely. Or you finish a meal and think, okay, what exactly was in that?
Right. Well, today we're digging into those kinds of mysteries. Welcome to the deep dive. This is where we take all sorts of art, research, you name it, and pull out the absolute must-know info for you.
Think of it as your shortcut to getting smart on stuff that matters, without drowning in data.
Exactly. And hopefully we make it a bit entertaining along the way. Today's deep dive is fueled by some really interesting consumer insights from June 26, 2025, all gathered by the news aggregator Consumers.app, and specifically their commentary section, Consumers 360.
Yeah, some great stuff in there.
So here's the plan. We're going to uncover those sneaky hidden fees, look at some maybe surprising health bits about our food, get you tips for traveling safely with food allergies, which is super important, and wrap up with some core food safety basics for your own kitchen. It's all about empowering you. Ready to jump in?
Let's do it.
Okay, first up, those extra charges. They seem to pop up everywhere, right? We're starting with a headline from WMUR Channel 9 on MSN.com. Consumer reports how to avoid junk fees amid new FTC efforts to curb extra costs.
Right, and the big news here is the Federal Trade Commission, the FTC. They're bringing in a new rule.
Okay, what's the rule?
Basically, it mandates that businesses have to show you the full price up front. No more hiding fees until the last second.
So aiming for more transparency.
Exactly. It's a broader push against those, junk fees that catch you off guard right when you're about to pay. Think hotel resort fees, concert ticket fees, that kind of thing.
Yeah, those are the worst. They really change the perception, don't they?
They absolutely do. Our sources, looking at consumers' research Q&As, show these fees really breed distrust and, frankly, annoyance. You feel tricked, you leave negative reviews, you might not go back. And it's not just here. Several countries are actually seeing legal challenges over these undisclosed fees. It's seen as pretty unfair.
Makes total sense. But what if, hypothetically, the fee structure was meant to help someone, like lower prices for certain groups? Does that change how people feel?
That's a really interesting angle. There was a study mentioned on benevolent price discrimination.
Okay.
And it found, maybe surprisingly, that most consumers still don't like it. Even if the idea is to give discounts to, say, low-income folks, many people felt it was unfair and said they'd rather shop elsewhere.
Wow. So it's the principle of equal pricing that matters most.
It seems so. People want fairness, And then there's research on complex pricing, what they call nonlinear pricing.
How does that work?
Well, it shows we often misunderstand it. We tend to look at the average price maybe, but companies can set things up so the cost of buying one more item, the marginal price, is confusing.
So you end up spending more without really realizing how the price scaled up.
Exactly. And psychologically, those surprise fees, they cause real stress. It just chips away at your trust in that business, makes you less loyal.
So the hidden cost is more than just money. It's trust and stress.
Definitely.
What about things like pay what you want? That feels like the total opposite.
It really is. PWYW can be great for engagement, making you feel in control, but its success really hinges on you feeling it's fair.
How so?
Your decision on what to pay is influenced by how much you think it costs them to make it and what you think is a normal price for that kind of thing. Transparency is key there too.
And the FTC's role in all this.
It's crucial. They're the ones setting rules, enforcing antitrust laws, trying to keep things fair and transparent, protecting consumers from, deceptive stuff. They're vital for market trust.
Okay, that definitely changes how you might look at that final bill online, doesn't it? Maybe gives you pause before clicking confirm purchase.
For sure. A little healthy skepticism is probably good.
Right. Okay, let's stick with costs, but shift to ordering food online. Another place where the final price can be surprising. Our next headline is from CNBC TV 18. Ordering food online. You might be paying more tax than you think.
Yeah, this one hits home for a lot of people. You see the price of the burger or whatever. But then you get hit with service fees, delivery fees, sometimes surge pricing if it's busy.
Surge pricing for food.
Right. And then on top of all that, taxes. These can really stack up and make the final bill way higher than you expected.
And the tax part isn't straightforward either, is it?
Not at all. Especially in the U.S., sales tax varies wildly from state to state. And some states actually tax the delivery service itself, not just the food.
Oh, wow. So it depends entirely on where you are.
Exactly. It creates this complex patchwork, making it hard to know the final cost until you, see the final cost.
Okay, so fees and taxes.
Yeah.
What else is going on in the online food world, according to the research?
Well, there's some interesting stuff on the packaging side, actually. Sustainable packaging is getting smarter.
Smarter how?
Think biopolymer-based electrospun nanofiber membranes.
Whoa, okay. Translate, please.
Basically, super thin plant-based fibers woven into packaging. They're not just better for the environment. They can actually release tiny amounts of natural preservatives to keep food fresher longer. It's called active packaging.
That's really cool. Packaging that does something.
Yeah, pretty neat. But back to the less cool stuff. How these platforms affect our choices.
Right. Does ordering online make us eat differently?
Studies suggest it can, yeah. Often negatively for healthy choices. You get way more exposure to fast food options, creating what researchers call cyber food swamps.
Cyber food swamps. Like a digital version of a neighborhood with only fast food joints.
Pretty much. All those unhealthy options are just a click away, making it harder to resist.
Makes sense. Is technology helping anywhere else? Maybe with waste?
Yes, definitely. There's work using deep learning AI for demand forecasting. It helps predict how much food will be needed, optimizing inventory and supply chains. This reduces waste by smoothing out what's called the bullwhip effect.
Bullwhip effect.
Yeah, it's where a small change in demand at the consumer end causes massive swings further up the supply chain, leading to overordering or underordering. AI helps dampen those swings.
Fascinating. And what about the food itself? Ingredients?
Well, there are always concerns with online orders about, synthetic ingredients, high calories in fast food. It's always smart to check ingredient lists if you can. And don't forget electronic payments.
Oh, I fit in.
They're convenient, obviously, but payment processors charge transaction fees. And guess who often ends up covering those fees?
The consumer. Baked into the price somewhere.
You got it. Another small addition to the final bill.
Okay, so next time you're ordering dinner on your phone, maybe take an extra second to look at that breakdown, see where the money is really going.
Good advice.
All right, let's move from the cost of food to what's actually in it. This next headline from CNN on MSN.com is a bit of an eye-opener. Food dyes aren't the only reason to stop eating artificially colored foods.
Yeah, this gets into some important health territory. Artificial food dyes are under scrutiny.
Like which ones?
Well, a common one is Allura Red AC or Red 40. You see it everywhere. But studies have suggested possible links to hyperactivity in kids and even potential carcinogenic effects. Regulatory bodies like the FDA here and EFSA in Europe are always reviewing the safety data.
Any others?
Tartrazine is another one. It's a synthetic yellow dye. Research has shown it can cause liver damage in animal studies.
Liver damage. Wow.
But interestingly, the research also looked at gallic acid, which is an antioxidant found in plants, and it showed promise in actually reversing some of that liver damage in rats exposed to tartrazine. It helped normalize liver function markers, protect cells. It's a fascinating hint at how natural compounds might counteract synthetic ones.
That is fascinating. Like a natural antidote, almost. Does this point towards more research in that area?
I think it has to, right? It shows how complex the interactions in our bodies are. But the concern isn't just dyes. The sources emphasized ultraprocessed foods more broadly.
Define ultraprocessed for us.
Sure. These are foods made with industrial formulations, often using ingredients you wouldn't typically have in your kitchen. Lots of additives, engineered fats, sugars, salt.
Okay. And the price.
Experts really advise limiting them. They're strongly linked to health issues like obesity, heart disease, metabolic problems. And that's beyond just the artificial dyes they might contain. The processing itself seems problematic.
And there's an environmental angle, too.
Yeah, artificial dyes and sweeteners, too, actually, are seen as emerging environmental contaminants. They persist, they don't break down easily, so they end up in waterways. It highlights a need for better waste treatment.
So it's a health issue and an environmental one. What are the alternatives if people want to avoid these artificial colors?
Thankfully, there are great natural options. Beet juice gives lovely reds and pinks. Turmeric is fantastic for yellow. Spirulina algae can provide blues and greens. They're derived from plants, generally safer, and obviously much better for the environment.
Good practical tips. It really drives home that it's not just about taste, is it? It's about the bigger picture of what's in our food and its impact.
Exactly.
Okay, let's shift gears again. Staying safe while eating, but this time when you're traveling, especially with food allergies. Our fourth headline is from The Conversation on MSN.com. Traveling with food allergies. These 8 tips can help you stay safer in the skies.
This is so important, especially as more people travel. First off, let's clarify. Allergies versus intolerances. They're different.
Right, how so?
An allergy is an immune response. Your body mistakenly sees a food protein as a threat and releases IgE antibodies. This can cause reactions from hives to life-threatening anaphylaxis.
Like the immune system involved. And intolerance.
Intolerance is usually digestive. Think lactose intolerance. It's uncomfortable, unpleasant, but generally not life-threatening because the immune system isn't directly involved in the same way.
Got it. That distinction is key. And allergies are common.
Increasingly so. Around 4 to 8% of people in developed countries have them, and it's more common in children than adults. Interestingly, some research points to specific immune cells, CD4 T cells, playing a big role in both causing allergies and potentially in desensitization therapies. It's complex science, but we're learning more.
Understanding the science definitely helps appreciate the seriousness and the management needed, especially when traveling. It's not just being a picky eater.
Absolutely not. For someone with a food allergy, management means strict avoidance always, and having an emergency plan is non-negotiable.
Like carrying an EpiPen.
Exactly. Carrying epinephrine, maybe wearing medical alert jewelry, and when traveling, communication is critical. Talking to airlines, hotels, restaurants before and during your trip, knowing where local clinics or hospitals are, just in case.
Preparation is everything. The sources mentioned something called EOE.
Yes, eosinophilic esophagitis. It's an allergic condition affecting the esophagus, often triggered by food allergies. Research is trying to develop better ways to predict and diagnose it, especially in kids, using cellular markers and history. Earlier diagnosis means better management.
Makes sense. What about preventing allergies in the first place? There's talk about introducing foods early.
Yeah, that's a really interesting area. The thinking is that introducing potential allergens gradually early in childhood might help the immune system build tolerance and prevent allergies from developing. But it's still evolving research, and it definitely needs to be done carefully, often with medical guidance, based on the child's individual risk factors. It's not a one-size-fits-all approach.
Understood. And if someone suspects they have an allergy, how is it typically diagnosed?
It can be tricky. It usually starts with a detailed medical history, maybe an elimination diet where you remove suspect foods, then skin prick tests or blood tests looking for those IgE antibodies. But the gold standard for confirming an allergy is often an oral food challenge that's done under strict medical supervision where the person eats tiny increasing amounts of the suspected food to see if there's a reaction.
Right. Needs to be done safely. This is all such vital info, whether it affects you directly or someone you know. Makes a huge difference for safe traveling.
Absolutely.
Okay, for our last segment, let's bring it right back home to the kitchen. Basic, but essential stuff. Our final headline is from WHSV on MSN.com. VDH, how to cook and store food properly to avoid getting sick.
Yes, the fundamentals of food safety, so important. Foodborne illnesses mainly come from pathogens bacteria like E. coli, salmonella, listeria, viruses, parasites.
The usual suspects.
Pretty much. They cause vomiting, diarrhea, fever, the unpleasant stuff. And people's immune responses can vary a lot. Sometimes symptoms show up much later, making it hard to track back to the source.
Right. And there was a specific event mentioned in the research that really changed things.
Yes, a really significant one. The 1993 E. coli outbreak on the West Coast linked to undercooked burgers. It was devastating.
I remember hearing about that.
It directly led to the creation of a Stop Beef Foodborne Illness. It's a major nonprofit now, pushing for prevention, awareness, policy changes. It really shows how a tragedy can force important progress in public health.
That's a powerful example.
Yeah.
So what are the core principles they and others like the WHO promote?
The World Health Organization has what they call the 5 keys to safer food. They're pretty straightforward but critical.
Okay, what are they?
1. Keep clean, wash hands, surfaces. 2. Separate raw and cooked food, avoid cross-contamination. 3. Cook, thoroughly kill the bugs with heat. 4. Keep food at safe temperatures, hot foods hot, cold foods cold. And 5. Use safe water and raw materials.
Seems simple enough, but are they universally applied?
That's the challenge, especially in developing countries. Lack of infrastructure, limited clean water, even cultural practices can be hurdles. But simple innovations help, like tippy-taps, low-cost hand-washing stations, and promoting safe local food preservation techniques. Adaptation is key.
So context matters hugely.
Absolutely. Even the COVID-19 pandemic had an unexpected effect. A study in Jordan found women improved their food safety habits more hand-washing, cooking food fully because general hygiene awareness was so high.
Interesting ripple effect. And the cost of not following these guidelines must be huge.
It's staggering. Globally, foodborne diseases cost around $110 billion a year in economic losses.
Billion,
Mostly hitting low and middle-income countries, and the human cost. 600 million illnesses, 420,000 deaths annually. It's a massive public health burden.
Wow. That really puts the importance of washing your hands and cooking chicken properly into perspective.
It really does. And it highlights why food safety guidelines need to be tailored. You can't just give generic advice if people lack refrigeration or reliable clean water. Solutions have to fit the local reality.
Absolutely. These basics really are universal lifesavers. So, wrapping up today's deep dive, we've gone from hidden fees that inflate your bill to what's actually in the food you order online or buy at the store, and right down to keeping things safe in your own kitchen. It really shows how understanding these details, these trends, these safety measures can genuinely empower you to make better choices every single day.
It really does, and it makes you think, doesn't it? Considering all these hidden influences and factors affecting our choices and health, how might our collective awareness, knowing all of this, actually shape where industries and public health go in the future?
That's a great question to ponder, something to definitely mull over. Thank you so much for joining us on this deep dive today.
My pleasure.
And if you found this useful, please do like, share, and subscribe to Consumers 360. Keep those essential insights coming. We'll catch you on the next one.